Greetings. This is the Counter-Racist Evolving Engineer Platform. The acronym for the program is CREE, C-R-E-E, and that is my handle. The date of this recording is April 16th, 2020, and the time is approximately 8:30 p.m. Pacific Daylight Time. Right out the bat, I want to let you know that this is not a David Icke, Alex Jones zeitgeist video. I do not hold that there is an overall plan to enslave or destroy all people, regardless of race. I don't even hold that there is an overall concerted conspiracy to do that to black people. But you see, to paraphrase the late, great Dr. Frances Cress Welsing, racism, which she defined as white supremacy and I define as anti-blackness, is simply a pattern of thought, speech, and behavior consciously and subconsciously determined. So there's no need for a deliberate, concerted sit in a dark room with a long table and have meetings to conspire against us. The behavior of people who practice anti-blackness naturally synchronizes one with the other because they have the same objectives, the same fears, and the same awe of black people. I'm going to, in this video, be repeating some things I've said in the previous 3 or 4 videos. There's no way to avoid that because not everybody who's going to happen by this video has seen the previous 3, and repetition is helpful. I know it's helpful for me in terms of internalizing what I'm hearing and getting a better understanding of it. But the basic platform here, the basic content of this video is its title: Stop COVID Blackfacing, the doorway to global electronic monitoring. So I'm going to lay it out. And for all of you who are sequestering out there, sheltering in place, complying with medical martial law, the fact that this is going to be a rather lengthy video might be welcomed. It might be something constructive to fill your time. And it's not going to be perfect. You know, you might hear papers ruffling or whatever, but I did take some time in putting this together because I think it's incredibly important. We're at an unprecedented time in history. So let's start with the definition of blackfacing. It is the false presentation of black people doing or having something far more than non-black people. Obviously, I meant in a harmful way, even though it doesn't say that on the graphic. And its ultimate end, as I see this ball rolling, is what you see there on the screen. It is not true that black people are contracting, getting sick, getting seriously sick, and dying from COVID than other people, although you'll see it all over the internet. The data does not bear that out, not in the least. There are so many things that are said about us that are false, that we don't read, that we sell and deal drugs more than anybody else, that we care less about our children's schooling, that our females, our women are more obese, more overweight than other women. So many things that are not true, but yet you can find it all over the place. You can find that black people are more deficient in vitamin D than other people. And this last one I bring up because any objective scientist of nominally in nominal intelligence should have questioned any finding that said that black people were more deficient in vitamin D than other folks. And I don't care, even with the reasoning set forth that vitamin D is manufactured through a process that's very like photosynthesis, which melanin screens out. And since we now live in North America and we're in modern lifestyles, we don't get as much sun, and so therefore we're more likely to have vitamin D deficiencies that can cause illness than anybody else. A nominally intelligent and sincere scientist should have questioned that, because it was well known at the time that that was being said, and that was being said for years. It's still being said. Go look it up. They should have realized it couldn't have possibly been true, because vitamin D is critical to the health of bones, bone strength, bone density. And the people in the United States with the highest bone density and the most healthy bones are Black people. So it couldn't have possibly been true. The tests that they were using were faulty. In this case, what I'm going to show is that the way COVID disease is being determined is faulty, is a result of individual physician bias, and then it's also been institutionalized by some legislation that was recently passed. So, and maybe a couple of other things. But as I said, it's not a conspiracy in like a star chamber where people sat down and decided to make this thing happen. But the end result of it is going to be what you see on the screen if we don't stop it. We will become a threat to humanity, and we will have to be quarantined from the rest of humanity. That's the threat. And once we see that threat, we will gladly accept the alternative form of incarceration, which is going to be electronic. So this is a very famous political quote. It is by Rahm Emanuel, who was President Obama's chief of staff, and he was the mayor of Chicago, a place that is said to have this incredibly high number of Black people who've died from and gotten seriously ill from COVID-19. But it's a very famous political quote that's often used, and it's true that some people believe this, people in politics, whatnot, and behind the scenes, in front of the camera. You never let a serious crisis go to waste. And what I mean by that, it's an opportunity to do things you think you could not do before. And this, as you'll see on the screen, is really a rendition of something said by Machiavelli, the author of The Prince. But hip-hop heads will know of Machiavelli, even though they pronounce it different, Machiavelli. So that is what I think is going on here. Some people all over the world have taken this opportunity to further their personal agendas for power. Some will be greater power, some will be successful, and some won't. But knowing the system of anti-Blackness the way that I do, I know that if we don't do something very different than what we're doing and what we have done, the only objective that will be left standing and having been completed is the increased surveillance and control of Black people globally. First here in the United States, and then the other three places where I predict it will take place are Nigeria, Ethiopia, where there are some Black people, and South Africa. Now, why those four places? The U.S., Nigeria, Ethiopia, and South Africa. Well, those four places are the places where Black people have the greatest demonstrated potential to do things to sustain and protect ourselves technologically from being used parasitically by the non-Black people who, through their network of behaviors, constitute the system of racism, that is anti-Blackness. I've got a few pictures here that I just want to start off with, just kind of as an introduction, which is basically what I've been talking about so far, and then I'm going to go into depth. This is part 2 of Stop COVID Blackfacing. The one I did a few days ago was only, I think, 14 minutes long. And this is going to be quite a bit more in depth. So I'll start out with just a few pictures. We've all, I don't know. I don't know any Black people who don't know of someone who hasn't had one of these on. So you can see here a lot of young Black men with the ankle bracelet, the electronic monitoring. So they don't have to be locked up behind bars. It's hooked up to a computer system, and people know where they are at all times. But see, that's difficult to sustain because you'd have to, first of all, it pretty much only applies to males because 90-something% all over the world, regardless of race, in the United States, regardless of race, and of course amongst Black people, males constitute 90% of the people who transgress the norms enough to get locked up, or to get into that monitoring system. If you want to control a much greater percentage of the population, if you want to be able to monitor greater than you are now, if you want to be able to monitor the other half of the population, the women as well as the men, you can't be relying on a setup that is based on them getting convicted of a crime. That's where cell phones come in. Many of you may already know that that's the plan in the works, but we're going to go into it in some depth, along with me showing the statistics that will show that this whole thing it's all there for us to see. Not that what they're saying about how deadly COVID is, what they're saying about how contagious it is, and what they're saying most definitely about Black people being more prone to contracting it, getting sick from it, and dying from it are just completely untrue. And so the question becomes, why are they doing it? What's the end game? Well, this is the end game. And you say, well, why do they want to control us? Well, I've already told you, because we're getting to the point now where technology is a great equalizer. People can code on their phones in places like Nigeria and Ethiopia. Here in the United States, Black people have more access to resources and more access to learning how to do things than any other place on the planet where Black people are concerned. But increasingly, because again, technology is a great equalizer, cell phones can do amazing things. And they can't watch us all as it is now. So they need a more efficient way to track us. All biologic systems, organs and or organisms require energy. And I do hold, based on the evidence, that the system of anti-Blackness is a biological system. It is not something that is merely taught. It's innate. It's biological. Instincts are biological. Sophia Stewart, who is the true author of The Matrix, was the conductor of that message to us, that we are the battery that makes the world go. We are the golden goose. Not just our physical labor, that's small potatoes. It's our creativity in every field of endeavor, always has been. The inventors of much of the technology from the 20th century and the 18th century, that came from Black people who were enslaved, who wanted to make our jobs easier, that we never got credit for. But that went on throughout the 19th century, throughout the 20th century. So many inventions that were done under government service were done by Black people. But there is also the technology of speech, because speech and language, the way syllables are put together, this has a great effect on how the mind works. It's a social bio technology. And Black people in the United States are wizards at that as well. We are wizards compared to the rest of the population. And so everything runs off of us. They cannot afford to let us escape. They have to know what we're doing at all times. They cannot afford to be cut off. They cannot afford for us to turn inwards and use our talents just for ourselves and to be able to protect ourselves from them trying to stop us from doing that. They can't afford that. They can't let that happen. Now, I was asked in the comment section of my last video, how are you going to stop it? How are you going to stop COVID blackfacing? I don't want to get sidetracked, but I'm going to address both that question and I'm going to address the person who made it in a way that I hope will address others who might be of the same persuasion in terms of commenting on this channel. But first, let me just read what's up here on the screen in answer to the question. When people are unsuccessful in their attempts to deceive one or more other persons about something in order to harm the others, they strongly tend to stop and switch tactics. That's white-collar crime. It's smart crime. And you stop once you find out you're not deceiving folks. You don't want them to get too angry at you and start coming at you, and you don't want them to start suspecting you so that they are so suspicious the next time you try to deceive them that they catch you again. So this causes them to work harder. If they have to stop and switch tactics, it causes them to work harder and less efficiently, creating more time for us, the intended victims, to mount a defense or an offense. You know, some people say the best defense is an offense. Less efficient tactics that they might have to employ if they can't deceive us could include direct violence. You've heard Mr. Neely Fuller say that innumerable times, the author of the Code Book. If you don't know what that is, just look up Neely Fuller. But I think most of the listeners here know who he is. Racists will use direct violence when they cannot use deceit, but they greatly wish to avoid direct violence because it is more expensive in effort, more expensive in material resources, and it decreases their quality of life, always fearing reprisals. I did an interview of an author of a book called The Spirit Level, and that was basically the data that was put forth, that in societies where there are the greatest inequities, the greatest gaps in wealth and access to things that are important, like transportation and education, etc. Not only is the health of the people on the bottom worse than if it were an equitable society, but so is the health, both psychological and physical, of the people on the top. And that's because they have to always be looking over their shoulder. So if you can't affect a system of domination in a very smooth, sweet, pleasing, efficient way, it's a scary place to live. It's like the Israelis living over there amongst the Palestinians. You never know what's going. You never know what's coming next. So they don't want to do it that way. And we're back around to the visual, because a picture is worth 1,000 words. Okay. So we'll take that one off. And just to let you know, this is not going to just keep going on and on and on forever and have the same effect on us as it is on non-Black people. So here's a little video to demonstrate that.
Thousands of protesters, many in cars and trucks, took to the streets of the state capitol in Michigan.
I've lost 2 jobs now, and I think it's time that Michigan gets back to work.
They're furious over Governor Gretchen Whitmer's lockdown restrictions, the toughest in the nation.
I'm going to ask you all to disperse.
Tempers are flaring across the country.
This is America!
In Raleigh, North Carolina, protesters gathered on sidewalks holding signs that read, "Reopen North Carolina." Many not wearing masks and ignoring social distancing. The message is being echoed by some of the nation's business leaders.
Fauci and the people in the medical area, those people would like to see no deaths, no infections. Boom, everything is safe. It's not going to happen. It's not going to happen for a long time. And we can't wait to the end.
Okay? So white people are not going to put up with this, and they're not going to put up with it for very much longer. What they're going to do is think about it. Now think about what the logic is. white and other non-black people are not going to put up with this sequestering medical martial law for much longer. They're just not going to. And yet, you have a very powerful other group of non-black people who are saying, but we need to contain this pathogen. So what do you think they're going to say? Well, you've got to do it a smarter way. And even I have a video up talking about a smarter way. What do? You contain the people who are most vulnerable / most threatening. And who would you say everybody believes are the most likely to transmit this infection than anybody else? Bingo, you got it. Black Americans. That, just Google it. You don't even have to Google it. Everybody knows, oh, black people are more likely to get it than anybody else. We're more likely to die of it. We're more likely to get sick from it. And some people, before I go on to the next video, some people think that this is an opportunity, like Rahm Emanuel said. It's an opportunity, and we shouldn't let it go to waste. That it's an opportunity for us to get some measure of reparations. That everybody can see now that the disproportionate number of black Americans who are getting sick from this thing because we have comorbidities, because we have underlying health conditions, is because of the legacy of slavery. And everyone can see it plain as day. And that this is the opportunity that so that stimulus package, just give us at least that much or some fraction of it. If you know the system of racism, anti-blackness, you know that is not the direction it's going to go. The crisis opportunity will be used to further the system, not to dismantle it. What evidence have you ever had that crises have been used to dismantle the system of racism and help black people out? When they have done so, it has been incidentally, as soon as they found out that it could possibly help us, they've stopped it. That's what The Color of Wealth says. That's what all the documentation says. So now that we have these white people, and I'll just play it a little bit here. That's not the one. These people.
Thousands of protesters, many in cars and trucks.
And when I say white, sometimes I'll slip and say white, but for me, white and non-black are synonymous. Now that we know that they're not going to put up with it, and that we know who they're focusing on having smarter incarceration, basically. We know who that's going to be. Well, it wouldn't surprise us that we see a black surgeon general. We've seen a disproportionate number of them. It doesn't matter if they're in the Republican or the Democratic Party. It's really important to have a black face out there blaming black people for our illnesses. Very important that we not believe that it is the system of racism, which is the people who practice it, who are causing our discomfort, our disease, and illness. So you got to have a black face. So after so now here we go. Here's going to be the black surgeon general saying the following. Jerome Adams.
I need you to know you are not helpless. And it's even more important that in communities of color, we adhere to the task force guidelines to slow the spread.
Community of colors,
Stay
stop.
at home
He means
if
black
possible.
people.
If you must go out, maintain 6 feet of distance between you and everyone else, and wear a mask if you're going to be within 6 feet of others. Wash your hands more often than you ever dreamed possible.
And everybody
Avoid
knows he
alcohol,
means black
tobacco,
people. He doesn't mean
and drugs.
Hispanics, quote
And call
unquote.
your friends and family. Check in on your mother. She wants to hear from you right now. And speaking of mothers, we need you to do this, if not for yourself, then for your abuela. Do it for your granddaddy. Do it for your big mama. Do it for your pop-pop. We need you to understand, especially in communities of color, we need you to step up and help stop the spread so that we can protect those who are most vulnerable.
Step up and stop the spread. So there we go. Blackfacing COVID. Perfect blackface, perfect covered. Step up. Step up and stop spreading it. Take the abuela out of there. Stop that. You're not talking about them. You're talking about black people. Okay? Next video. Where is this headed?
Most of the transmission that's actually happening in many countries now is happening in the household, at family level. In some senses, transmission has been taken off the streets and pushed back into family units. Now we need to go and look in families to find those people who may be sick and remove them and isolate them in a safe and dignified manner.
Remove them and isolate them in a safe and dignified manner. Remove them and isolate them in a safe and dignified manner. What does that mean? Obviously. Safe means they're coming with force. Dignified means don't put up too much of a fight. We're not going to humiliate you. Come with us willingly, so we don't have to use this show of force that you see behind me as I knock on your door in full military gear. And who, the World Health Organization, is an organization that the United States is following on this thing. And just it happens to be a pun, who do you think they're talking about? Who are they going to forcefully remove? Who is being threatened with being forcefully removed? And probably sick or not. Because remember, what he said is we want to stop the spread of the pathogen. And it's moved into the home now that it's not on the street anymore because so many countries are in lockdown. That's in the transcript. That's in the full video. All you have to do is search for it. Of course, it's moved into the home. But if we haven't reached out to you and said we're sick, but that's not enough. You got to find out who's got the thing. And they've already said who's primarily spreading this thing. That's why Jerome Adams said, do it for your granddad, do it for your pop, do it for your big mama. And then he threw in Abuela in there. You know, of course he had to do that. Wow. Okay. Now we're going to move into how they're getting away, how the racists are getting away with tagging black people as the face of COVID. Because it has sounded in the news stories, so many people believe that there's been some objective testing, some objective measurement that just says that a black person has it. I think I showed in the last video that's not true, and many people already know that. And that we are dying from it at disproportionate rates because we have such higher rates of comorbidities because we're unsafe and because we're unhealthy. And that's because of our lifestyle changes. You know what Jerome Adams said is don't drink alcohol, don't take drugs. Are you telling the white people who lead the drug epidemic and opioids that? And it's been demonstrated that black people don't drink or use other drugs any more than anybody else. And yet you're saying this? And what does that have to do with COVID? Are you what? Because what? It causes what? It causes upper respiratory disease? That's not our issue. That's not what we die from. We die from that at less than half the rate of white people. Less than half. White people have it more than twice as often. That's what they die from. That's not in the top. Those are not the top leading causes of death for black people. And that's smoking, but what does drinking and using alcohol and using drugs have to do with it? Other than the fact that people associate black people with lack of self-control, with every cause of misery that we have, and for anything that has anything to do that makes other people uncomfortable and sick. It's astounding coming from a Surgeon General. A physician. Okay, well, let's listen to this white doctor talk about, we're going to begin to see how they've been able to pull this off, to be able to make it seem, to get everyone to believe that something's true that is completely untrue. This is how they did it. Now, he's not going to talk about black people in this one, but you're going to begin to see how they pulled it off.
Just already wearing thin.
And doctor, in that same CDC guidance sheet on COVID-19, it references the fact that basically this is a judgment call for doctors on how to fit. You know, I read it. What goes on line 1, and then what goes on line 2, and what goes on the final line as far as contributing factors and ultimate cause of death. but they concede that it is a judgment call. Again, why is that not correct?
Well, let's just take influenza. If I have a patient died a month ago, had fever, cough, and died after 3 days, and maybe had been an elderly, fragile individual, and there happened to be an influenza epidemic around our community, I wouldn't put influenza on the death certificate, and I've never been encouraged to do so. I would put probably respiratory arrest would be the top line, and the underlying cause of disease would be pneumonia. And in the contributing factors, I might well put emphysema or congestive heart failure. But I would never put influenza down as the underlying cause of death. And yet that's what we're being asked to do here.
Dr. Fauci was asked about the COVID death count today. Here's what he said in part.
What do you say to those folks who are making the claim without really any evidence that these deaths are being padded, that the number of COVID-19 deaths are being padded?
You will always have conspiracy theories when you have very challenging public health crises. They are nothing but distractions.
Conspiracy theories, doctor? So you're engaging in conspiracy theories. What do you say to Dr. Fauci tonight?
Well, I would remind him that anytime healthcare intersects with dollars, it gets awkward. Right now, Medicare has determined that if you have a COVID-19 admission to the hospital, you'll get paid $13,000. If that COVID-19 patient goes on a ventilator, you get $39,000, 3 times as much.
Okay, so Dr. Jensen showed both the way it has been institutionalized to make Black people the face of this, because he talked about Medicare paying more money for diagnosing a patient with COVID-19, regardless of what the true cause of illness is or cause of death. And he talks about the greater incentive for putting them on a ventilator. And the survival rate of people who go on ventilators is very low, very low. So it's an invasive procedure that endangers one's health. But they're being incentivized to do it. And they're being incentivized to diagnose patients with having COVID through the Medicare system. Well, who in this country is most likely to use the Medicare public health free medical care? Who? You got it. Black people. So that's the way it's been institutionalized. But on top of that, you said, in that same video, he said there are always some physicians are really public health minded. So regardless of what the true cause of death is, if there's any relationship to something that happens to be going on as an issue in public health, those doctors will go along with it and just put down that cause of death that happens to be the cause celeb at that time. Okay? But it is a judgment call, just like it was with AIDS. We're going to go into this in a lot of death. This is going to be a long video. I'm going to show you a lot of PDFs. But they're making judgment calls. Now, if you are a non-Black person and you have a bias against Black people, you probably want to give them a COVID diagnosis because it's going to cause them distress. And it does have some stigma to it. Not like AIDS, but some. If it were connected only to white folks, it would not. But it has developed a certain amount of stigma because now it's, well, you can stop yourself from getting it if you practice proper hygiene, if you practice proper social distancing. And as you can see from the first video I showed you of those white folks having a protest and it happening all over the country, you can see they're not practicing social distancing. They're going to church. They're having protests. They're going to spring break, kissing each other all over, just all up on each other, and all of those kinds of situations. But yet we're the ones who are getting tagged with practice social distancing, be responsible, do it for your big mama, do it for your pop-pop. And then you've got us believing that we're more prone to get it, and we show up at a hospital with a little something this, a little something that, or maybe something even quite serious. But the practitioner, the physician, is going to steer you towards a COVID-19 diagnosis. It's just a matter of discretion. And just like they did with AIDS, they're doing it with COVID because it's a matter of discretion. And the CDC guidelines on how to diagnose COVID-19, anybody can go to a website and find it, and I'll show it to you here in this video. What's next? Here comes the part for the people who are really, really information junkies. Because I think I have something like 40 PDFs to show you. I think it's all very interesting. I'll try to be animated and whatnot. But people are going to doubt what I'm saying is true. And they're going to doubt it because, well, I'm a black person and a black woman at that. So yeah, people are going to want to know, well, why did you say that? What's the basis of that? I want to see your proof. Okay, so I'm going to show you proof. But before I do that, I want to review some things that I talked about in the last video. Here we go. So the 6 steps to renewing blackness as a disease, like they did with schizophrenia, AIDS, and other STIs, bipolar, now COVID. And I don't think I'm going to go through all 6 of them like I did last time, but I'm just going to emphasize the first one and the last one. The first step is to exaggerate the scope of the disease. And probably the second one too. Just exaggerate the scope of it. Secondly, make it ever-changing. Make the symptoms ever-changing. The latest symptom of COVID that had nothing to do with what happened in Italy, had nothing to do with what happened in China, but now it's blisters on the toes. This is exactly what happened with AIDS. Anything could possibly be COVID-19. Or with COVID-19, it started out as just shortness of breath, a dry cough, not just any kind of cough, a dry cough. And now it's the third one I'm missing. Shortness of breath, a dry cough. Shortness of breath, dry cough. What's the other one? Yeah, well, I'm not going to redo this video, so I'll come back to the third one. You guys are yelling at the screen, but it'll come to me so obvious. Temperature. Yeah, fever. Sorry about that. Okay. Those were the 3. And now, they've added an inability to smell and taste, a cough with phlegm, in other words, not a dry cough, slight shortness of breath, not heavy shortness of breath, now blisters. There's probably a few other things. This is what happened with AIDS. It's just like, ma'am, negress, negro, did you say that your ankles hurt a little bit when you got up this morning? You'd never experienced that before? Did you know that's becoming a common symptom of COVID? I mean, it sounds ridiculous, but I really wouldn't be surprised if that was not the next one. But the final step, and you can always pause the video if you want to read all 6 of them. Again, this is what they did with AIDS. The final step is telling us that we get the thing more than anybody else, which they've done. They tell the whole world that. And that they want to protect us. They want to treat us. They want to stuff ventilators down our throat. They want to give us treatments. They want to give us drugs like AZT, which are toxic for the liver and actually depress the immune system, which killed a lot of black people that they diagnosed with AIDS, who really had no AIDS symptoms. They've done that. They did that in Africa without any test at all. I'm going to show you all of the stuff, proof of it. Okay. And so they're increasingly doing that with COVID now, as they put the ventilators down your throat, as they worry you and suppress your immune system because now you're all worried. And just being in a hospital itself is it's much more of a risk factor than being around a black person. Hospitals and the errors they make and the pathogens that circulate, not having anything to do with COVID. Being in a hospital a prolonged length of time or for any length of time is risky because of all the things that can go wrong. All of the pathogens you can catch, all of the drugs that you are given that you shouldn't have been given, all of the overdoses you've been given, the failure to turn on a machine or turn off a machine, these kinds of things, it's a real risk to our health. And then they, in that step where they're supposedly helping us, the other thing they do is that they confine us for our own good, but more for their good, because we are the great risk. Stay away from us. The way to make sure you stay away from us is that you confine us and you track us. Okay. That's that video. Not video, I'm sorry. That's that PDF. So, in further answer to a commenter, how are you going to stop it? How do you stop it? How are you going to stop the COVID blackfacing? This idea that we can't stop anything they do, the system of anti-blackness, the system of racism exists, and therefore we're doomed forever. I mean, okay, why don't we just lay down and die? Like literally? No, there are things that we can do. We can put up a fight. We can put up a skirmish. Now, ultimately, we are going to have to be able to physically defend ourselves. But in the meantime, knowing that they do not like direct violence, we can buy ourselves some space to work. And there are times when you can stop an attempt at deceiving us. Like the head of the World Health Organization and the Director General was an Ethiopian man. And when it became a international scandal that these white French scientists proposed using Africans as guinea pigs for the first vaccine trials for COVID-2. So that's what it calls SARS-CoV-2. The COVID-19 coronavirus. Black people took to social media with absolute outrage and directed their tweets towards influential people in media and in government. And it got finally to a question that was asked by a Nigerian man at a briefing of the World Health Organization. And the Ethiopian Director General, who looked like a black man to me, said it was an affront it was shocking, it was an affront to humanity, and Africans will not be used as guinea pigs. They had stopped that in its tracks. Now, they still might be able to get over there and do some of it, but not to the extent that they were doing it. It's going to be much more difficult. They have to pull back now. That has caused them to now have to exert more energy to figure out how they're going to get away with this. Because black people in Africa, for up to this day, still are testing low. Not getting sick, not dying, and they are being tested. Yeah, you're going to want me to prove it. I will prove it. You know, you can't have it both ways. You can't say, listen, I want to see proof of what you're saying, and then say, well, I want your videos to be super short. You can't have it both ways. You know, you can't please everybody anyway. Okay, so how to stop the blackfacing of COVID. You know, I don't think I ever addressed what it was that I wanted to say about a particular commenter. And she knows who they are. If you cover my comments with rebuttals, comment after comment, video after video after video, long comments, I'm going to wonder why you're not spending more time making your own content. If you think you understand the system of anti-blackness more than I do, to the extent that you can go on and have these long rebuttals, video after video after video, comment after comment, why not spend your time more productively and create your own content? Because when you do it on my channel, what I have observed is that it's very repetitive. I answer you time and time again, and you keep saying the same thing in different ways, video after video, comment after comment. I have addressed you, but you just keep spamming my channel. Then people come to my channel and they see that there's been no response because at some point you are using up my time in an inefficient way, and it feels like you're doing it purposely. Once that begins to happen, I will remove your comments. You can still come here and listen if you like to, and you can get another channel and try to start it all over again. But if you are of a mind to do that, it's not going to work. I'm not going to allow you to derail the content here by asking the same questions in different ways over and over again. Go do your own content. I didn't say thank you to those of you who have stuck with me and who do listen. But I'm sorry, I did have to address that particular person and any other person who is of that same mindset. Okay, now, to answer that person's question, which I was planning to do anyway, how to stop the blackfacing of COVID. Number one, these are very practical and very serious things. Ask for a copy of the medical chart, including nursing and doctor notes, on a daily basis, those of yourself and or dear one, whether you are an inpatient or outpatient, when receiving treatment for any condition that includes symptoms that are currently being publicly discussed as COVID symptoms, and stay up on that because they change every day. Blisters now on hands and feet of children, even though children supposedly don't come down with this thing. Okay. Ask for a written explanation of any COVID diagnosis, whether or not, and put that, and when you ask for it, make that request in writing yourself so there's a record. So ask for a written explanation of any COVID diagnosis, whether or not a COVID test was done. And the COVID test itself is very questionable as to its accuracy. Be prepared to hand the healthcare provider a news article citing a peer-reviewed study. So it could be just Time, Newsweek, New York Times, New York Post, LA Times, whatever. On one of those big publications, there's going to be an article about racism in medical care in the United States, and that article will reference a peer-reviewed article. So just print one up, have it ready for you anytime you go to the hospital. That's what I do. That's what I do when I accompany my mother. That's what I do when I accompany my father with my daughter. I always have it there, and I've had to use it a couple of times, and it's been helpful. So make sure that you have that with you and that you're prepared to hand them. Let me just read the sentence. Be prepared to hand the healthcare provider a news article citing a peer-reviewed study on the anti-Black bias in medical care. They are easy to find with any search engine. Be courteous when doing this. These people have your or your dear one's life in their hands. Be courteous. And in addition, it's helpful if you can afford it to send an appreciation basket. You can, fruit baskets, candy baskets to the nurses and therapists before making such inquiries as is suggested. And I put that in purple because that is critical if you happen to be sick or someone that's near and dear to you is. And of course, you're going to have to be doing it by distance. So you're going to have to fax stuff, email stuff. But you can have, I don't know, can you have something delivered nowadays? Can you have a candy basket delivered? You might be able to do that. You might be able to have it delivered to the outside, but maybe they don't want stuff from the inside coming in. So that may be defunct now because they don't want probably anything coming in from the outside that might be contaminated. Number 2, be familiar with the leading causes of death and illness in specific geographic areas and of Black and non-Black people in those areas. This video is going to help with that. And so you might want to cue it up and keep it in your watch later or your favorite videos where it does start talking about that so you can reference it. But be familiar with that. This way you will know when someone is not telling the truth about what percentage of hospital beds have COVID-19 patients in them. So one-person show here, one-person band. Bring to the attention to the maximum extent of your influence of other Black people, this is number 3, the correct facts about the known and unknown effects of COVID on Black people. And then this video is going to help you with that. Number 4, repeatedly post and repost findings of misinformation or disinformation as it affects Black people on COVID based on your understanding above. On Twitter, direct this to media personalities and government officials. When you do so, be courteous. People tend to make how you say things an issue and not focus on the content of what you're saying when you're discourteous. Number 5, reduce your consumption. This is so key. Reduce your consumption of television news by half each week until you have eliminated it completely, because this is how they're programming us to believe the false propaganda they're putting out against us. Exert your maximum influence on other Black persons you interact with to do the same without promoting conflict with those persons. We don't need greater conflict between Black people. Number 6, be surgical about the news. When you're going to cut out TV, so be surgical about the news you do consume on the internet or in hard copy format. Subject all news you consume to logic and to evidence presented or that you actively find. Follow logic, not persons. actively seek information to support anything you see, hear, or believe on the subject. Be a thinker. And to be a thinker, you need information. And when you get that information, you want to validate it and verify it as much as possible. This is what we need to do as individuals, and the more individuals in the Black collective that do that, the harder we're going to make it for them to deceive us. This will make them exert greater energy. They'll back off and try something else. Number 7, when other Black people become discourteous to you in your attempts in items 5 and 6, which is trying to get them to stop watching television so much and being surgical about the information they do seek and consume, do not return the discourtesy. Ask them if they would like you to stop, not stoop, stop sharing your views on the matter or on any matter. If they respond that they would like you to stop, do so immediately. Repeat steps 2 through 7. I'm hoping you don't have to repeat step 1. Hoping that you don't have a dear one in the hospital that is in danger of being diagnosed with COVID. But 2 through 7, it's a cycle. Keep doing it. Okay? If this goes longer than I want it to, and I know I know the time frame I have in my mind of it being too long, I'll break it up and do another part. Okay. This was discussed in the last video, but all I showed was just the picture, basically. I didn't actually go through what it said. But here we are being told that we're more likely because of our comorbidities to contract COVID-19, but we have a much stronger immune system. And the more African genes we have, well, I'll just go through it. This is from October 20th, 2016. This is UPI, United Press International. You don't get more mainstream than that. Researchers say that based on laboratory studies, the cells of Black Americans mount a much stronger immune response to infection than those of European Americans. That hardy response, this is anti-Blackness. You can count on it every time. That hardy response might have a downside, though. It could play a role in Black Americans' higher risk for heart disease, stroke, and autoimmune inflammatory diseases, the researchers said. I'm not making fun of people who have heart disease and stroke. I'm just saying having a dysregulated immune system is something completely different than having a strong, effective immune system. They are equating a strong immune system with a dysregulated immune system. They're completely different things. But, they have a need to automate their domination of us. So when you have a need to dominate the automation, you have a need to dominate people, you want to automate it for the same reasons I just talked about, because you don't want to spend a lot of energy dominating them, because you want to get better and better at doing it, and you don't want it to disrupt the quality of your life. So part of that automation is just having it set in your mind that Black people are inferior in anything that is important to you. So you need to constantly reinforce that. Now, if Black people show that they are as good or better at something that you had previously considered important, your need to automate your anti-Blackness, your psychological anti-Blackness, will make you then put into effect a deprioritization, or saying that whatever you previously held to be important is no longer important. Such as you probably find it hard to believe that there was a time when Black men were considered incapable of boxing. They were incapable. They didn't have the strength, the physical strength, or the courage, or the skill. That, in fact, that's what the 1936 Olympics were all about in Germany, in Nazi Germany. And Jesse, but you think that it's just limited to that kind of extreme with Adolf Hitler and the Nazi Germans. But in fact, Jesse Owens, who was like the Usain Bolt of his time, he just won everything. He said that he felt more snubbed by the president at that time, Franklin D. Roosevelt, than he did by Adolf Hitler. Because Adolf Hitler Jesse Owens went to the box beneath him, and Adolf Hitler smiled at him briefly. This is what it says on the record, and he gave him a small Nazi salute. But FDR invited all of the champions from the Olympics to the White House when the Olympics were over, but he didn't invite Jesse Owens. So, I mean, this is why when Joe Louis was fighting Max Schmeling, it was such a big deal to black people and to white people, because they didn't believe that black men were capable of that. They didn't believe that black people were capable of the skill necessary to play baseball or basketball, any of those things. Now, we take that for granted, but now it's deprioritized as just being a game, and it's not as important. It's just black people are physically superior, but, we have small brains. We have inefficient brains. But yeah, we have stronger immune systems. We don't have dysregulated immune systems. So anytime a pathogen comes along, whether it's viral or bacterial, what have you, the evidence is that we fight it. Now, it's not just this particular study that shows this. The data on mortality shows this, which I will show you. This is what the data on mortality shows us. We are far less likely to fall ill to a pathogen because we have obviously stronger immune system by definition. Next one. I don't want to close all of you. No. Do I want to do that? Nah. I'll just cancel it. And go to the next one. This is, again, is just that map. I decided to go with different colors this time. Very, very light purple. The lightest purple possible. That's most of Black Africa. And then even the next darkest level of purple, 100 to 1,000. That's a pretty wide range. But most of those, actually, I'm going to say all of those areas in Black Africa, which will be right here, not here, because the horn is down here. So right here, that area right there, they're going to be more towards in the hundreds, in the low hundreds, out of millions of people. And then when you get down to South Africa down here, well, we know what's happening down there. We know they have a lot of non-black people, a lot of white people, a lot of Indians, more white people than Indians, but yeah. So, that means I need to go back to this one, because I think there was something else I wanted to show you in regards to that map. Yeah, here it is. What they're saying about Black Americans in this article that says that we have a stronger immune system, the strength of the immune response was directly related to the percentage of genes derived from African ancestors. Basically, the more African you have in your genome, the stronger you're going to respond to infection. And so that goes to this map here. But look at how Africa has responded. Look how Black Africa has responded to COVID-19. Again, this is like the vitamin D thing. Something's not adding up here. One thing here doesn't look like the other. It doesn't make sense. And anybody of nominal intelligence and sincerity would have said, it doesn't make sense for you to be saying that black people are dying of this thing at a greater rate when we know they have stronger immune systems. We know they do. We know they do here because we've done the studies. We know what the rates of mortality are to these types of diseases, and we look at Africa. So we need to figure out what we're doing here. Oh, it's biased. Guys, stop doing that. But no, of course, they're not going to do that. Okay. Next. All right, so let's talk about the reasons. I had a pretty interesting conversation with an old friend on the phone. He called me. He lives across the country. He actually lives in Louisiana. And he called me because he saw the stuff that I was posting on social media. And I don't know if he listened to or watched any of my videos. But he was trying to get an understanding of what I was saying about stop the blackfacing of COVID-19. And so he said, well, yeah, I see the same thing you do in terms of how it looks like Africa is not being affected by this thing. But A, we don't know that it's not going to happen. And B, it could be for other reasons. So I asked him, friend, let's call him Jack. Jack, that's not his name. Jack, what other reasons could there be? And he listed the same ones I could think of. Well, it could be, and Kofi and I discussed this on previous videos, could be that people just aren't going there, aren't traveling there as much as any place else. Nobody wants to, nobody does. And so they haven't had an opportunity to be infected because hardly anybody goes to Black Africa. That's one of the reasons. There are 3 reasons. I'm going to address them all. but because I haven't addressed this one with data before, I'm going to address it. The other reason is that it could be the weather, right? It could be the people have said, well, maybe in warm climates, in tropical climates, COVID-19 does not spread as fast. I've addressed that, but I'll address it again. The third one is that maybe they're not testing. Maybe all that's showing is that Africa doesn't have the capacity to test for COVID-19. And they're not. That's not true either. I've shown that in my previous 2 videos. I have addressed this one, but only sort of anecdotally with my co-moderator at times, Kofi. But now I'm going to address it with data. So you can say, well, no one's going into Africa, and that's why they have such low rates. Well, okay, here's the thing. Let's look at Kenya. Okay, Kenya has greater air traffic than all of the nations that are listed underneath it. All of them. Okay? And the numbers that you see next to each nation reflect the number of cases of infection, and then after the double slash, their deaths per million. Both of these are per million, the infections and the deaths. So Kenya has 3 infections per million people. 3 infections per million people in Kenya. And 1/10 of one person. 1/10 of one. So basically, not even a tenth of a person per, if there were such a thing, per million persons. So to get to one single person who died of coronavirus, you would have to have 10 million people. 10 million people to get one death. Okay, that's Kenya's rate of infection and death. But Poland has less air traffic than Kenya. Considerably less, and I will show you that. But look at their infection rates. 147 per million people compared to Kenya's 3 per million people. What is that? By a factor of, I don't even know. What is that? A factor of 50? Yeah, by a factor of 50. Like 5,000 times as much. And then compared to Kenya's 0.1 per million, Poland has 5 per million. That is, again, 50. 50 times as much. Okay? Ukraine has less air traffic than Kenya. Look at their numbers. All of them have significantly greater numbers of infection and significantly greater numbers of deaths per million people than Kenya, even though they have less air traffic than Kenya. Look at Iceland. Look at Iceland's numbers. Look at Kenya's numbers. But Kenya has more traffic than air traffic than Iceland. And you might say, well, it's about temperature. Well, what about Tunisia? Tunisia's hot. And again, there's no evidence for that. I will show it to you for the 3rd time in 3 weeks, 4 weeks. Nigeria. Nigeria has more air traffic than all of the countries beneath it. Notably Denmark. More air traffic than Denmark. More air traffic than Syria. More air traffic than Jordan, Uzbekistan, Croatia. But look at Nigeria's numbers and look at the rest of them. That completely debunks that it is about people not going into Africa. Completely debunks it. So it's not that. All right? We know that that should never be brought up again. Okay. Yeah, I'm going to close these. All right, I'll go to the next one. I want these out too. Close it. Okay. Go to the next one. You may be saying, I don't know if you're making that up. CREE, you might be making that up. Because black people, especially black women, they're not very smart. You're not very smart, CREE. Okay, this is where you would go. So if you want to put it into a search engine and you want to find out how many passengers are carried into a country in a given year, you can go to this website right here. Does it say it on the bottom? Yep, there you go. There, right there is your URL. Well, Here's your URL. You don't believe me? Go check it out yourself. That's it. That's where I got my numbers from. Okay. That'll give you passenger traffic by air. Yes, I want to close it. What's that? Okay. Next. This is real data heavy. We have knocked out that nobody's going there. The next one is, and why is this important for us as Black Americans? Because they say the degree to which our immune systems are stronger is directly proportional to how much African genetics we have. They found that our immune systems are stronger. And so now we're trying to get to, well, why does Africa have such low rates of infection and death? We've already knocked out that it's impossible that it's because no one travels there, because places that receive much more air traffic have much higher rates. Places that have much less air traffic than Nigeria and Kenya have much higher rates of infection and death. So that's not the reason. Okay, so then let's go to the next reason, which we've discussed. Well, it is Africa after all. It is Black Africa. They're not testing. That's all it is. They're not testing. And once we go in there and start testing, now they might start going in there after they've started playing around and giving untrialed vaccine, which is a little bit of the disease that gives people the actual disease. Because they're Africans, will probably still fight it off. But we'll know something funny has happened by then, because we know that Africa tests. We know that they do. Let me get this right here. I meant to highlight this the last 2 times that I used it. Are you going to let me highlight it? You're not going to let me highlight it? No. I didn't want to go there. All I want to do is highlight it. Won't let me. So it's this very first paragraph. I think, just a second. It's not COVID. Just my throat is dry. I'm going to have to clear my throat. Hang on. Okay, I'm back. So first paragraph. While delays and limited test kits have left sick Americans in the dark. Is that where I wanted to start? That is not where I wanted to start. Maybe it is. Let me see. Let's see. Yeah, it is. And actually, it's the second paragraph. Okay, I'm sorry. The second paragraph right above this yellow part. Part of that is thanks to the fact that many African countries preemptively prepared for the outbreak by setting up testing capability as long ago as February. Okay? Because they were ramping up for Ebola. They were already ramped up for Ebola, and the international community rushed in there just knowing they were going to find high rates of infection, because that's what they did with AIDS and HIV, AIDS / HIV. And, Africa had just got done with the Ebola thing, which is a place in Africa, and yet we're not supposed to call it the Chinese flu. So we know that they're testing. And Senegal had even gotten so far as to manufacture their own tests. I know this is repetitive for some people. But so now we know that it's not that they're not testing, because they were ahead of the United States. They were ahead of a lot of European countries in testing. They're testing. They're just not sick. Or A, they're not sick. Okay. And B, whatever the coronavirus test kits now test for, which may or may not be for the pathogen that is causing this illness that is still not defined, because you can't keep changing the symptoms of a thing and saying that it's a disease. So, for instance, let's say there was a disease that you called it, I don't know. Well, let's just start with measles. Suppose it is raised areas on your skin that are very itchy and you have a fever. Okay, but now if I start adding that I see stars in front of my eyes. And then the next one is in the next week or so, it's arthritis. You get arthritis. And then the next one is that you can't, you have to at some point define a disease. It can't completely be overlapping a whole bunch of other stuff, because you don't know that's what you have no idea that's what it is. If something has some symptoms for months and months and months, or even years, and then suddenly you add 5 or 6 more symptoms, you have to ask yourself, what disease is this? But that gets me off of the track of what I wanted to say next. Been going at this for an hour. Okay. I'm going to stop at the 2-hour mark, and if there's anything left over, and there probably will be, I'll do another part. All right. That's the plan. So we know that it's not that they're not testing. They're testing. That's not what it is. So it's not that they're not testing, and it's not that no one goes there. The third one that they tried to say it was that it's hot in Africa. It's hot there. It's not as hot other places. And SARS-CoV-2, the pathogen that they say causes the coronavirus disease of 2019 and going forth, they say that disease, they tried to say that disease, that pathogen spread less quickly in warm weather. So Oxford, University of Oxford, University of Renown in Great Britain, they did a whole bunch of stuff on COVID-19. And so this is one of the things they did not too long ago, March 23rd. Do weather conditions influence? You see this as a news story, as something that's actually proven. It's not proven. It's false, just like so much of this stuff. So they say, do weather conditions influence the transmission of COVID-19? And they do some double talking here, because they say emerging evidence appears to suggest that weather conditions, I guess appears, they're experts at words, appears to suggest that weather conditions may influence the transmission of COVID-19, with cold and dry conditions appearing to boost the spread. The weather effect, they say, is minimal. However, it's minimal. And all estimates that are minimal are subject to significant biases. So they're saying emerging evidence appeared to, but then when we looked at it, it's so small, it's not worth talking about it. And even though it's very small, even that, it's got so much bias in it, we cannot corroborate it. So it appeared like it did, but no, it didn't. So no, it's not the weather. It's not the weather. It's not that they're not testing, and it's not that nobody goes there. What are you left with? You're left with what the researchers said about the immune systems in Black people. It's stronger. And that's what the mortality data tells us if we compare it by race. And if I don't get to anything else in this segment, I do want to get to that. Next. I think we're getting there right now. Okay, here it is. So, it takes time to get data in, because it takes time to get all the data in and it takes time to crunch it. So here in 2017, 3 years ago, barely, here were the leading causes of death by race. And in the box here is the most important part. I put it in pink because I thought this resembled their skin color. And so, again, white and non-Black are interchangeable for me. And so, when people start talking about Asian, the Asian statistics are almost always better than white folks' statistics. And Hispanics, there's no point in talking about that, because they always say Hispanics could be of any race. So you really don't know what you're talking about when you're talking about Hispanics. Okay. All right. So we're just going to stick in terms of the data. We'll stick with black and white persons. All right. So 8.9% of deaths of white people are from lower respiratory illness, like what they're saying is killing people with COVID. Respiratory failure. Your lungs simply won't operate anymore. Can't get oxygen, you die. They're inflamed, it's pneumonia, or they're just inflamed, the tissue's inflamed. That's what COVID is. COVID is a respiratory illness. In terms of it being fatal or making you very sick, that's what it is. It's not the fever, it's not the cough. That's not what's killing people. It is lung dysfunction. It's respiratory failure. So when it comes to respiratory illness, meaning something like COVID, or the respiratory effects of flu, or pneumonia from any number of causes, when it comes to that, Almost 9% of white people die from that. Now, what percentage of black people die from that? 3.3. 3.3%. That is more than twice as likely, obviously. Almost looks like it's 3 times as likely. It's not. I'm going to check my numbers just one more time here because, I mean, it looks like 9 and 3, but I'm pretty sure I got the numbers right. So, yeah, just real quickly, 8.9 divided by 3.3. Yeah. Actually, it should have been 2.69. So it is closer to 3. So this number here, the 239%, it should be 269. Okay, 269%. These deaths are more than twice as likely for white people. 269% more likely for white people than black people. And yet COVID, which is this type of disease, is being attributed more towards black people because black people have comorbidities. Well, if that's what causes you to be more prone to respiratory illness, then why isn't that a leading cause of death? Because there's always been flu. There have always been kinds of pneumonias. And if the comorbidities of hypertension, of, you say obesity, which is not true. We're not any more obese than white folks. But if that hypertension and what's the other one? Heart disease, which is not true. We don't die from heart disease at a greater rate than white people. I mean, so there's so many lies. But for any reason, pathogens have always been around that affect the lungs. If these other things made us more susceptible to them, we would have been dying from them at a greater rate then. Well, how is it all of a sudden another pathogen that affects the lower respiratory system in the lungs comes along, and suddenly now, because of the same underlying chronic illnesses that you say we have, some of which are true, some of which are not, how is it that this one came along and suddenly now that makes us more likely to die from it and get sick from it? Does that make any sense to you? It's absolutely absurd. Leading causes of death for black people. Diseases of the heart, 23.2. And what I'll do is go back and forth. So for black people, diseases of the heart kill 23.2% of us. For white people, it's 23.3. Are we more likely to die from heart disease? No. Despite the fact that they say we're more obese, we don't eat healthy, we are not more likely to die from heart disease. I mean, it's just mind-boggling the propaganda we've been fed. Okay. Now, do we die at earlier ages? Yeah. Do we die from all causes at a greater rate? Yeah. Chalk that up to racism. Because even when they control for access to healthcare, when they control, because you don't know how you're getting treated when you get that healthcare, when they control for income, when they control for education, black people are still dying at greater rates at younger ages. But anyway, we don't die from heart disease at any greater rate. We don't have heart disease apparently at any greater rate, or we certainly don't die from it at any greater rate. Okay, the next one is cancer. That's what malignant neoplasms mean, cancer. For white people, it's 20.8%. What is it for black people? Not that, and these things are not that important in terms of this subject matter, because what we want to get to is lower respiratory disease, but we can kind of go through them because we can unlock some of these other lies. So you see that it's 20.8% for black people, and then you go down to white people. What is it? 21.4. Well, I'm sure that's within some statistical margin of error. It's dead even so far for the top 2 causes. Okay, for black people, accidents kill 5.9% of us. And for white people, accidents kill 5.8% of us. But see, let's stop here with where we are with white people. What do you see above accidents? For us, accidents are the third leading cause. Third leading cause. For them, it is the fourth leading cause, because what's above it? Chronic lower respiratory disease, like COVID-19. That's what COVID-19 is when it kills you. It's a lower respiratory disease. That is the third leading killer for white people. It is not for black people. It is not even on the leading causes of death on this chart. It is not in the 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Yeah, I thought so, 10. It is not in the 10 leading causes of death for Black people. Respiratory disease, lower respiratory disease is not in the leading causes of death for Black people. That is even though Black people have higher rates of asthma. Even though. Okay? Our immune systems are stronger and it's less likely to affect our lower respiratory systems to the degree that we die. That's not us, that's y'all. And yet somehow they've made Black people the face of this and we believe it? How did they do this? We know it's not true. How did they do it? Well, you've already seen how they've done it. They've done it by discretion. There is no reliable test. They aren't testing most people, even with the unreliable test. Clinicians, doctors are just giving Black people a COVID diagnosis. 1, because they have a bias against us and they want us to be the face of illness. 2, because it's been incentivized through Medicare that they get more money for diagnosing COVID-19 no matter what you come in there with. Like I said, you see a butterfly at night, you got COVID. That's one of the leading causes. That's how they're doing it. And I really don't even want to go on with the rest of it. Look at influenza and pneumonia is 2% for white people. And what is it for Black people? Not on the top 10. It's not even there. Now, septicemia, some of you will say, some of you know a little bit about healthcare. Maybe you're a nurse, you're a doctor. Okay. Well, that's a rampant infection. Usually it's bacterial that is so bad that it has gotten into your bloodstream. And Black people have a higher rate of that. However, I hope I can show the data, the PDF in this video, if not the next, that shows that is because of what is happening, what is being done to Black people when they're in the hospitals. They're getting poor care. They're being subjected to these pathogens because they're not taking as great a care of Black people. But in terms of just native illness, no, we're not more likely to get it. And even when we get septicemia, not sure. I know I had a point about that, but they'll come up further. But yeah, we just don't. Oh, that's what it was. So what the study said was that when you compared Black people who are not in clinical situations, if they're not inpatients, when you compare Black people to white people, Black people are less likely to have septicemia. It is only when they get to the hospital after they've been in there some time. It's a very dangerous place to be for a Black person. It is only then that they get sepsis. Infection so bad that they get into the bloodstream. I mean, you get sick and you have to be fearful. We're behind enemy lines at all time. You get sick, you get hurt. The racism that is practiced by the EMS, by the doctors in the emergency room, in the hospital if you get admitted. It's like MASH, You're the enemy that's getting taken care of by the medics on the other side. Sometimes you make it, sometimes you don't. Okay, now, here's what's happening. Here's what's happening with COVID-19. We already know that it's a clinical decision. And so when they say that Black people are more likely and it's to die of COVID-19 and it's because of our comorbidities, we know that it's not now, because we know that even with the same conditions that we've always had and with other pathogens coming out that affect the lower respiratory system, it's never affected us then. So we know that's not what it is. So what's really happening with these higher diagnoses? Well, we know that it's, like I said, it's a clinical decision, it's discretion, it's bias, and they're able to just attribute deaths that Black people experience from anything to COVID-19. And yes, mortality, meaning deaths per 100,000 people, if you measure it that way, we already know that because of racism, there are so many ways to go. Let me count the ways, there's 100 ways to leave your lover and there's 1,000,000 ways to die. But accounting for all the things, like I said, education, income, education, income, and insurance, access to healthcare. There's still all these excess deaths by black people. And there's a Surgeon General who once said that. It's just attributable to racism, from the stress from racism, okay? And mistreatment from racism. So yes, black people die from all causes at a higher rate. And for whatever we happen to be sick from, or that we happen to pass away from, that we would have passed away from anyway, they're just putting it in the COVID-19 column. That's all that's happening. Because we have a greater rate of dying from all causes. Greater rate of dying. All right. This is the HIV thing here on the bottom. HIV is rather like COVID, very much like COVID. It's a decision. You know, a test comes back, or a couple tests come back in the United States, and it's about how you read it. And in Africa, they don't. You can look at who has a way of classifying illnesses and determining the cause of death, and they'll say that in many African countries, you know, there won't even be a doctor there. And so then they direct you. There's no doctor. There's not a doctor to even look at the symptoms, let alone administer a test. And they will still put AIDS as the cause of death on the death certificate. Yeah, hopefully I'll get to that one so you can see that one. What's next here? Oh, well, it's exactly what I talked about. So ICD, International Code for Coding for Disease, ICD. So they introduced a new one on March 24th, 2020. They said it's alert number 2. This is the new ICD code introduced for COVID-19 deaths. So this is for clinicians. This is for doctors. This is how you do it. So they tell you what the number is. It's U07.1. This is what they want everybody in the world to use. Okay. Coronavirus infection, unspecified site. Severe acute respiratory symptoms, SARS. All right, now let's get to it. When will this new code be implemented? Immediately. Let's read it all. Will COVID-19 be the underlying cause? The underlying cause depends upon what and where conditions are reported on the death certificate. However, the rules for coding and selection of the underlying cause of death are expected, are you reading this? Are expected to result in COVID-19 being the underlying cause more often than not. What happens if certifiers report terms other than the suggested terms? So they have suggested terms they want you to use. But what if you're a rebel and you refuse to use the suggested terms as a clinician? Well, if a death certificate reports coronavirus without identifying a specific strain or explicitly specifying that it is not COVID-19, NCHS, National, I'm not sure what that is, will ask the states, so this is for the United States, the National, we'll have to look that up. We'll ask the states to follow up to verify whether or not the coronavirus was COVID-19. As long as the phrase used indicates the 2019 coronavirus strain. So again, this is left to discretion, but you're just wording it differently than they want you to, because you feel pressure, but you still try. You know that it's something else other than COVID-19. So you're trying to comply with the pressure that's being applied by your superior at the hospital, but you know it's not. So you're using slightly different words, but they still say that this, I got to look this up real quick. What is NCHS? Let me just, give me a second to just look that up. NCHS. Some of you may have already done it while I'm talking. What is in an NCHS? NCHS, if I can type it right. Okay. All right. No? They're still not telling me what it is. I know it has to be national something. National Center for Health Statistics. National Center for Health Statistics. So back to this, okay. So the National Center for Health Statistics, which one am I on here? I'm here. Okay. As long as the phrase used indicates 2019 coronavirus strain, the National Center for Health Statistics expects to assign the new code. They say, however, it is preferable and more straightforward for certifiers to use the standard terminology. COVID-19, just do it like we asked you. Just do it like we said. Just do it like we said. We don't care if that's it or not. Just do it like we said. What happens if the terms reported on the death certificate indicate uncertainty? I'm not sure it is. I mean, I know he had pneumonia, or he had complications from cancer therapy, chemotherapy. He had that for 2 years. And then he got pneumonia. I'm not sure that that's COVID-19. Just like that white doctor said, he sees this patient. He's seen that the cause of death is pneumonia. Just because it happens to be a public health emphasis at the time, he's not inclined to just say that it's COVID-19. So what about a person in Dr. Jensen's situation? What do they want you to do? What happens if the terms reported on the death certificate indicate uncertainty? So the person just said, I'm not sure. If the death certificate reports terms such as probable COVID-19 or likely COVID-19, these terms would be assigned the new ICD code for COVID-19. It is not likely that NCHS, the National Center for Health Statistics, will follow up on these cases. So they just said probable or likely. We're not going to follow up on it. We're just going to say definitely. If pending COVID-19 testing is reported on the death certificate, this would be considered as a pending record. In this scenario, I'm going below the highlighting part. NCHS would expect to receive an updated record, since the code will likely result in R99. I don't know what that is. In this case, NCHS will ask the states to follow up to verify if test results confirm that the decedent had a COVID-19. Now, the only people, the last video I did, it had a young white teenager in which the Los Angeles County refused to certify him as having died from COVID, even though he was perfectly healthy and young. But a person who had pre-existing health conditions, by the way, which we've demonstrated has no relationship to lower respiratory disease, including COVID, but a person who has other things that could have killed them. This young teenager had nothing. You'd think that it would be more reasonable to say he died from COVID than somebody who had been sick for some time from some other things. But yeah, they refused to certify him. But when it comes to us, you better believe they're in a rush to do it. One, because they make money, and two, because they want us to be the face of disease, because they want to automate their bias towards us so that it doesn't take much time. It doesn't take much energy in their brain. Remember what Frances Cress Welsing said. Racism is a pattern of thought and behavior, consciously and subconsciously determined. So any more on this one? This was the bombshell right here. There's more. Should COVID-19 be reported on the death certificate only with a confirmed test? COVID-19 should be reported on the death certificate for all decedents, meaning people who died, where the disease caused or is assumed to have caused or contributed to death. Assumed, discretion, willy-nilly. Who do you think that's going to hurt? Who has it been hurting by the evidence? Okay. I'm going to close a bunch of windows now. Close all tabs. Yes? I don't know why you're asking me this. Just close all tabs. And close this too. I think I said I wanted to save it. Do you want to save changes? Okay, so I'm supposed to say no. All right. So, what's next? See, I line them all up for myself nice and neat. Okay, this one will show you the similarity that this has to AIDS, HIV and AIDS. This is from National Library of Medicine, National Institute of Health. Guidelines for HIV mortality measurement from Geneva, the World Health Organization. Again, this one is 2014. Obtaining cause of death information for HIV AIDS. I'll go straight to the part that I highlighted. The second part of this chapter presents methods to ascertain the cause of death when medical certification is not possible. This is the case for the majority of deaths in sub-Saharan, meaning Black Africa, as they occur at home without the presence of a medical doctor before or after death. So this high rate of AIDS, heterosexually contracted in Africa. Do you see how this happened now? Because it's not real. It's just the statistic made up. There's no way they could know. These people have very unclean water. They had diseases from waterborne pathogens. They could be dying from just about anything because we know they have a strong immune system. So they have to be bombarded with pathogens to die from them. It has to be something extremely virulent. But if, no one's around, either before or after death, and so it's just up to whoever in the World Health Organization to say, it was HIV, what do you think they're doing? How do you think that happened? Same way it's happening here in the United States right now with COVID-19. These are all the things that you want to be aware of. And I hope that people will share this. I hope that you will, even if you think it's lengthy, could you queue up the part that you think is important and then copy the URL at current time, the part that you think the person has the patience to listen for, and share it with people. I don't think I've asked people enough to share what I publish on YouTube. But I think this is so important. I hope you do too. Provisional death counts for coronavirus disease. Now, this is going to get to how widespread and how serious this disease really is for all people. Because remember, at the beginning, I said that part of the way that you make Black people the face of a disease is to exaggerate the disease for everybody. So this is going to raise a lot of questions about, it's Alex Jones-ish, and who's the other guy? David Icke-ish. But no, it's not. It's just, the data is just what the data is. Okay. So again, this is from the CDC. And this is again from the National Center for Health Statistics. Death counts for coronavirus disease. Very important, this definition right here. So when we get to the stats, and it says something about expected deaths. This is what you need to know expected deaths means. Expected deaths means the number of deaths received over the number of deaths expected based on data from previous year. In other words, years. In other words, how many people died this year from all causes compared to how many people died at this time of year from all causes in previous years. That's what expected death says. We expect there to be a certain number of deaths based on previous experience, based on previous years. So here's the logic now. Let's follow the logic. If we have something wreaking havoc, causing hospital beds to be overflowing, causing the number of dead bodies to be so overflowing that you have to store them in ways you've never stored them before, in refrigerated trucks, and I guess you have to assume they've never done that before. It's causing people to go on lockdown and not go to work, just 80% or whatever percentage it is of the workforce. This is so horrible. We should expect there to be more deaths from all causes. We won't even worry about if it's COVID-19. If you have this thing that is wreaking havoc, that is causing more people to die, we should have more deaths, period. Let's not worry about the source of it. Let's just get to the bottom line. The first thing we should see, before we even get to whether or not it's COVID-19, is whether or not there is anything that is causing greater amounts of death. Right? Are we following the logic? Okay, so let's go to the numbers. Let's look at expected deaths. I started here in March because at the end of February was just before it was the eve of this COVID-19 panicdemic. So on March 7th, and I just picked a few. Okay, let's make sure I can see the headings in the column. Okay, so percent of expected deaths. That's the one we want to look at right here, this fourth column. Okay, because we have the date, COVID-19 deaths from all causes as an all, it's an absolute number, and then percent of the expected deaths, which we just talked about. Okay, so in March of 2020, How did it compare to previous years? 94%. A little less. Now, of course, there's going to be a margin of error. But if you had bodies in the streets and bodies piled up in makeshift morgues, wouldn't you expect it to be considerably over 100%? 115, 130%, 120? Not 94. Maybe 94 is 100. Maybe it's 101, 102. But that's not what they're saying. 100, even if it was 105, 110. Even though I didn't highlight them, March 14th is even worse. 91%, 91%, 92%. Little less than what you expected. What's going on? We have this rampant pathogen that's killing people, but the all causes death. Well, you say, well, what's happened is the lockdown. Well, I left off something. This one is really, I try to put a sticky note on this one. 40%? This 40% of expected deaths on April 11th tells me they're trying to figure out what to do with the data. There's a bottleneck in the data somewhere because, see, when you begin deceiving people, there's a bottleneck. It's like Watergate. They're trying to figure out what to do with that data to make it fit, to make it work. Because it makes no sense for there to be only 40% of the expected deaths by April 11th. Now, what Governor Cuomo said and what some people are trying to say, which is laughable to me, because we've already seen what the leading causes of death are, was that the death rates have gone down from all causes because people have been on lockdown. This is what Cuomo said. He said, in this hospital, we basically don't have anybody, but we don't have any non-COVID patients. It's basically all COVID patients. Okay, well, we know the top killers are heart disease and cancer. What happened to them? Right? What happened to them? Those are the top killers. They just went away. It makes no sense at all to say that the reason that the death went down is because of the lockdown so that there's less trauma and less automobile accidents. There are minor causes of disease. They're the minor causes. They're not the major causes of disease. What happened to all those other causes that aren't even in the top 10 that have nothing to do with lockdown? Just diseases that people have. What happened to them? They just didn't die anymore? To say that they stayed away from the hospital, okay. That doesn't mean they didn't die. You mean, because there are people who are saying, well, this COVID-19 thing has got people staying home instead of going to the hospital because they're afraid to go to the hospital. Okay, so they should be dying at home, right? See, this is about what Rahm Emanuel said. I want to go back to that one. This has to do with not. These are always good to look at again. You never let a serious crisis go to waste. So there are people who are seizing upon this to launch their political careers, launch their campaigns for president of the United States. Some people say that one particular governor is launching his campaign, in quotations, as the president of a new nation state. I don't think I want to go any further than that. Who knows? This one might already get cut down. I don't know. But that's what this exaggeration of this disease is. Actually, it's not exaggeration. It's exaggeration that is so extreme that it's perverse. It's perverse, profane lying. And I am not minimizing the pain that anybody is going through that has a loved one or who themselves became ill. But just because you were seriously ill, and even if it was lower respiratory, does not mean it was COVID. It could have been allergies where you have a drip that's going down into your lungs and it's causing inflammation. And then you go in, of course, you're a black person, they tell you it's COVID. Maybe you never experienced it before because you were never exposed to that degree of toxins. Might even be just natural toxins or pollens in the air. Because I do believe that black people have a stronger immune system and we are not used to things that are in the environment that are not supposed to be there. Our immune system is designed for a very natural environment. And we're living in a very unnatural environment, and we have just a killer immune system. What's that? Go get it. So, this is going to explain the asthma, but even with our high rates of asthma, we don't die from chronic lower respiratory disease. You saw it. I showed you the numbers. But there are people who are seizing upon this for various reasons that are not necessarily directed towards us, but because no matter, you have warring politicians, Donald Trump against the governor of California or against the governor of New York, what have you, or against whoever the world leader is in China or whoever the world leader is in Russia or Italy or in Spain or what have you. You have that type of thing going on, sure. But in the end, some of them will be successful, some of them won't. The thing that they all agree on, however, will be the effect, the deleterious effect, meaning the killing of or the confinement of Black people worldwide. Okay. Let me go back to my proof. How am I doing for time here? I've got 15 more minutes. Yeah, I'm definitely going to have to do a part 2, and hopefully it won't result in a part 3. But I've said very much of what I wanted to say already. So, okay. I'm going to the next slide. It's just going to take me a little bit. Where was I? Did I lose track of where I was? Oh, okay. Well, maybe you can take my word for the fact that Cuomo said that he said what he said, because I had that here, but maybe I'll show it next time. Hopefully I remember that I didn't show you that one. Okay. Now they still keep saying. So they said it. At first it was just anecdotal reports. It looks like Louisiana's getting hit hard. It looks like Black people are getting hit harder by COVID deaths than any place else. Milwaukee. It was anecdotal. And then finally, Black people said, the ones who think that it's going to mean that they're going to help us more. We need racial data. Give us racial data. So we know how much harder hit we're getting so that we can have the resources. And so then as they released the racial data, it was funny. There were quite a few since the last time I came on here, since the last video, that showed, it showed that Black people in various places were dying from COVID at higher rates, and we already know how that's being determined. But even with all of that, this is how difficult it's being for them, and this is why we have to bring all this stuff to people's attention. Even with all of that, with all the discretion being used to incorrectly diagnose people with COVID, just the way they did with AIDS, even with all of that, they're able to show a few cities, they're able to show a few states where the number of Black people who've been diagnosed with it is greater than unknown. But there are plenty of places where unknown is greater than the number of Black people. But more to the point, they still have only released race data. Forget about ethnicity, because that just means Latino. We don't know what that means, because that means any race. They've only released data for 35% of the deaths. So we really don't know. Even though they're making up the stuff, we still don't even know that. But those are the ones that they're telling us, the ones that fit their narrative. Okay? So don't think that the data has proven it, because even if you believed that they weren't going against what nature has bequeathed us with, which is a better immune system, and the fact that respiratory illnesses are not on our top 10 lists of things that kill us, even if you believed that the good white doctors and the good white and Asian doctors and Arab doctors and Indian doctors and whatnot are really doing the best they can by us in diagnosing us with COVID-19, they still have only produced 35% of the racial categorization of the race of the people who have died through April 9th. So I don't know what to tell you. It hasn't proven anything. Okay, now. American video habits by age, gender, and ethnicity. So the way that you get Black people to believe this stuff, my mom was over here at my house today, and I was trying to explain to her in brief. I went out to meet her in the driveway. And I was trying to explain to her in brief what I had found and what I'm explaining to you. She said, well, why are all these people dying then? Why are all these people dying? Why are all these black people dying? Well, my mother has always been. Because, see, in her day, Walter Cronkite, Peter Jennings, they were journalists, and the news was like, it was like the Bible of current events. And she's still stuck on that. She doesn't understand the spin. And even then there was a spin, excuse me. There was a spin, but it was not as in your face nowadays. But so she's stuck, 24 hours a day watching CNN and MSNBC. And even though I showed Fox, I mean, the facts are the facts. The fact is that black people watch more TV than anybody else. This is where I got my data from. And this graphic is not even faithful to the percentages because it doesn't show just how out of it. This does not look like 50% more. When in actuality, black people watch 50% more television than white people and twice as much as Asians. And I'll just scroll through this so you can look at it. Video habits by age. And see, that's by age. We need to go by race. Well, I think I probably didn't have that one here, so that's okay. I've got one that will do the trick. And if not this time, the next time. But yeah, we watched 50% more television than white folks. So we are internalizing this stuff that keeps telling us story after story. Black Americans are being hit. African Americans are being hit by COVID-19 harder than anybody else. It's not true. I think I've proven it's not true. And I do have a PDF here that shows the same thing that I showed in the video with, what's his name? Jared Adams, the Surgeon General, the Black Surgeon General, saying, hey, black people, do your job. Stop smoking. Stop drinking so much. Stop taking as much drugs so that you don't get COVID-19, you don't spread it to the rest of us. Sir, I have a PDF that repeats it, but I won't give you that one. So, but yeah, well, I mean, this is the stuff that we're taking in. The point of me, I'm just going to just so quickly try to go through them. Yeah, this is, we're internalizing this more than anybody else because we're watching more TV. Okay. All this stuff about black people getting sicker because of it. And it's our fault too. It's what we're doing. We're not victims like the white folks. It's what we're doing. We're internalizing that stuff more than anybody else because we're watching more of it. More of what we're seeing. My mom's watching this. All but 3 people who died from COVID-19 in St. Louis, Missouri were black. Who's watching that the most? Black people. Because we watch more TV than anybody else. This is why I said at the beginning, try to reduce your TV consumption by 50% each week until you eliminate it. There are a lot more ways to be informed and a lot more ways to be entertained. But this is what black people are consuming. A constant diet of lies. COVID-19 disproportionately affecting black men in Milwaukee. I showed that one on the last video. Just a constant diet of lies. And they get us to, just a constant diet. About 1 in 3 people who become sick enough. This is NPR. This is not even ABC or Fox or in MSNBC, not the liberal or the conservative races. This is supposed to be like a verified source of information. National Public Radio, they're saying the same thing. CDC hospital data point to racial disparity in COVID-19 cases. Yeah, racial disparity because of what you're doing with your discretion. Go to the data yourself. You can find it out yourself. Here's another. Is this another one? Louisiana? 7 out of 10. We're consuming this stuff. Okay, now, just so that it sticks in folks' minds. Sometimes a picture is worth 1,000 words. I'm looking for it. Give me a chance. As they say, give me a chance. They say that in Spanglish. They say that in Mexico, actually. And then they'll give me a chance, and then they'll keep going with English. It's very interesting. Okay. Well, I had a graphic of us watching television a lot. I really wanted to show that. But I mean, it was a picture. Well, You don't always get everything that you want. You don't always get everything exactly how you want it. Okay. But see, this is spread beyond the United States. So now that Black Americans, very powerful media, have become the face of COVID-19, it has extended worldwide. So this is what Kofi was referring to in the comments from my last video. A lot of people are aware of this. We all know, the whole world knows that this thing started in China. Whether you think it was a lab or you think it was a wet market going from bats to humans. But we know that the epidemic started in China. And yet the Chinese are kicking Black people, Africans, out of apartments. The Africans who are based in China's southern city of Guangzhou, have described the development as discriminatory. They are accusing us of having the virus. A Nigerian student. Nigeria has like the lowest rate in the world. But because they have made Black people the face, and non-Black people who are not white are enthusiastically embracing that and acting upon it. See, they're smart people. They know it started there. And yet they're they're enthusiastically acting upon that. Because organically, they know that's what they're supposed to do as part of the system of anti-Blackness. Because of their consciously and subconsciously determined thought and behavior. It's not a conspiracy. It's just synchronization of behavior because of shared objectives. It will all pan out to the same thing. Now, was it just the Chinese? Credit here goes again to my crack researcher who brings me so much stuff. Sir Kofi, Sir Max Bigavels from New York. Arabs are doing the same thing. Arabs joined the global anti-Black coronavirus campaign. Thousands of Ethiopian workers are being abruptly deported from the United Arab Emirates and Saudi Arabia back to Addis Ababa over the weekend in cargo planes. The governments of both Middle East countries claim the Ethiopians were vulnerable to spreading the coronavirus and have deported some with alleged symptoms and many without, but not testing. And we already know Ethiopia is also one of those countries with a low rate, and some of them are Black people, some of them are not. There are a lot of Black people in Ethiopia, and a lot of that are not. But if you don't know what I'm talking about here, you need to go. You just got here. Just go back to some of my earlier videos, like the first 2, 3, 4, 5 of them. Okay. And then, even though we know that Africa has got by far and away the lowest rate of COVID infection, they're still trying to get in there. So what they say? They say, African nations missing from coronavirus trials. And a new influential research consortium launches a bid to accelerate trials in low-income countries, meaning Africa. Please let us infect you with a little bit of the disease. Solidarity. You know what? Remember what Neely Fuller said about being careful at new words? Solidarity trials. That's what they're calling it. Solidarity trials. You got to be. It's a lose-lose proposition. Seems like my computer is frozen on me because I can't get anything to move. Yeah. I may have too much stuff up. Let me see if I can close some stuff. I don't know why all of a sudden I can't move things. I'm going to see if I can open it again and get a different result. Mr. Bill Gates, your system doesn't work that great. It still won't let me do it. Okay. So they're calling it solidarity trials. You're not showing solidarity with the whole world. Massa, is we sick? We're supposed to be just as concerned about you being sick. We don't have this thing. Y'all got it. And we've suffered for generations, for hundreds of years with stuff that you're doing to us. And yet we're supposed to be so concerned. We're not sick, but we're supposed to take a chance at getting sick because you're sick. Massa, is we sick? I sure hope there's pushback. I sure hope the Director General, who's an Ethiopian man at the World Health Organization, which is a subsidiary, a subsidiary of the UN, pushes back. Sure hope so. Yeah, it bothers me like heck that this won't move, but if it won't, it just won't. Okay, now, remember the ankle bracelets? They're going to want to know where we are. You can't put an ankle bracelet on a bunch of black people. You can't do that. What you can do, however, is what they're already doing, have been for some time. But now they're going to say they're tracking everyone. But the idea is to track people who have had contact with folks who have been diagnosed as having COVID. Now, remember, that's not a real thing. That's just something that a non-black person throws at you. And the reason I would actually even say it's a non-black person, I know that there are black cops that are just as bad as white cops. But in this case, just that one anecdotal thing that I got from my Facebook friend about MLK Hospital, which has a lot of black medical practitioners, not having one single case as of a couple of weeks ago. I would say that it's non-black medical practitioners who are throwing this COVID label on black people for no reason at all, for a disease that really doesn't even appear to exist. If to the extent that it does exist, it's a typical flu that seems to be milder than the usual seasonal flu, only because deaths are lower. Maybe it's and if we're stretching it, we're saying it's slightly more severe than the regular seasonal flu. But we know they're going to want to track people who have had contact with people who have had this erroneous diagnosis. And who's that going to mostly be? Black people. And if you use phones, you get the women too. You don't have to have an ankle bracelet. Apple and Google, will it let me highlight? Yeah, there we go. Apple Incorporated and Google, there we go, unveiled a rare partnership. Apple and Google, they're supposed to be enemies. See, that's like the Confederates and the Union forces. Apple Inc., because when it comes to us, they synchronize. They unveiled their rare partnership to add technology to their smartphone platforms that will alert users if they have come into contact with a person with COVID-19. And they say people must opt into the system, but it has the potential to monitor about a third of the world's population. Now, we already heard the World Health Organization say that because of lockdown, infections have gone inside. And we have to go to people's homes to get the ones who have infected or have had contact with people who are infected. And I bet you this is going to go out to say, it's going to be secondary. Not only people who are infected, or said to be infected, not only people who have the disease, not only people who have had direct contact with them, but I bet you this goes out to a second generation of people who have had contact with those who have had contact with those who have been erroneously labeled with COVID-19. Okay, and if the World Health Organization is saying that we have to stem the tide for the sake of humanity's existence, do you think that they're going to just allow this to be voluntary? No, this is going to be placed on phones, and it's going to be embedded into the platform without you having to actually download any app at all, and it's going to be tracing you, and that's how they're going to know which house to go to. And they can cover just about all of us doing that. And here's the thing. Even if they don't come to our house and take us away like the World Health Organization guy said he would do. See, the idea is if you're so scared that they're going to take you away, seize you without any right to trial, without any witnesses, and just be in their indefinite detainment, just like what happened at Guantanamo Bay during the war against Iraq. We don't know what that had to do with in Afghanistan. Okay, so we don't want that to happen because God knows what will happen to us. We will more willingly say, oh yeah, just track me with my phone. You'll see I'm fine. You know where I am. We'll willingly go along with that because that's preferable to being taken away somewhere where our loved ones can't see us. And they're still going to do some of it regardless. I'm pretty sure of it. The technology known as contact tracing is designed to curb the spread of the novel coronavirus by telling users they should quarantine or isolate themselves after contact. It's voluntary right now. It's just like social distancing and staying at home started out as voluntary. contact tracing will start out as voluntary and then become mandatory. You won't have any choice. And we already know who that's going to disproportionately and unjustly against all the facts affect. We all know. Black people in the United States, Black people worldwide, emphasis probably on, I keep doing that, emphasis besides the United States probably being Ethiopia and Nigeria, which is what we've seen from the news stories that I just showed you. Okay, I think that was the end. I actually got to the end of them, and I think I may have done it, excuse me, within 2 hours. I think I may have done it. If I could, nah, I don't want to upload that. I'm not going to do it. So I hope I answered the questions that I said I would answer. And I very much hope that we will take every opportunity to correct people from their belief in false information, false data, propaganda. I very much hope we will do that. I was looking for those 6 steps again, or the things that you can do. And I cannot remember where I have it. But at least this gives you something to look at while I'm looking for it. About what you can do. Oh, I know what it was. It was the very first one. That's what it was. What can you do to stop the COVID blackfacing? That's what it was. Let me see if I can find it. Okay, let me open it up. And show it to you folks. I gotta get rid of Rahm Emanuel here. Go away, Rahm. You've done enough damage. Definitely oppose. Definitely offer some courteous but firm opposition if you or a loved one gets a COVID diagnosis. And let them know in advance you'll be looking for the reasons that they're saying that you have COVID. And you can bring in you can bring in a copy of the ICD and let them know that it's a matter of discretion and that you think that it is against the Hippocratic oath because it's subjecting you to things that may possibly worsen your health, both your mental health and your physical health. So definitely make sure that you come armed with data if you have to go. If you have to go, don't go if you don't have to. If you can take care of it at home, take care of it at home. Do not go to a hospital unless it is truly an emergency. And that's definitely true at this time of year with all the allergies for asthma, for people who have asthma. Just because I know so many Black people have asthma, even Candace Owens has asthma, Jerome Adams, the Surgeon General, all these Black conservatives, they have asthma. I mean, but I definitely sort of want to, if I can find it, I wanted to try to allay some fears about asthma. If I can. Yep, here we go. Okay. So let's go with this one. The data has been changing. I referenced one in one of the last 2 videos from this same college that said that from the data from China, asthmatics were not more likely to contract COVID, nor were they overrepresented in those who died from it. But the way that I saved that to my hard drive was by taking a snip, not like a screenshot, and it didn't show everything that it needed to show. And by the time I went back to the site to get the full one and get a PDF of it, they had already changed it. So I had to look around some more. And so I found this one on the American College of Allergy, Asthma, and Immunology because they're related. This is why a lot of people with asthma, allergies have asthma. So you may be thinking you've got COVID-19 and what you've really got is allergies, and then asthma induced from those allergies, from the drip that you have from your sinuses or your nasal cavities. But they say that elderly patients, as well as patients with severe asthma, so that means that you have to use your rescue inhaler like every day, several times a day, are most susceptible to increased morbidity, meaning death. Increased morbidity? No. Mortality means death. I guess morbidity means being sick from viral infections in general, not just COVID, but in general. But we've already shown, there have been viral infections forever and ever. But black people, even with asthma, we're not dying from that stuff. It's not in the top 10. But anyway, specifically asthma patients taking inhaled corticosteroids, ICS, should be advised to continue these medications as they have been shown to prevent or reduce asthma, blah, blah, blah. Okay. And then this one right here, the second one, a recent study reported that these inhaled corticosteroids inhibit one version of a coronavirus strain. So that's interesting, because if it does that, you would wonder why they aren't offering that to all the people who have had severe lung disease, supposedly from COVID. And eyebrow up, right? Supposedly from COVID. So then they say these severe asthma patients are at an increased risk to COVID infection, and optimal control of their chronic condition is of utmost importance. But then they go on to say allergic diseases, asthma, and COPD were not risk factors for COVID-19 infection. And gosh, that was actually the opposite of the one I wanted to show you, but it's okay. You could see all of them. That's the worst possible news. And that's even contradictory. Here's the one that I had intended to show you. Is that it either? That's the one that really, CREE. That's the one that I took the snippet of, and it didn't actually show what I wanted to show. And apparently I have made yet another error. The only way to avoid errors is to do nothing. So I have to accept them. And it looks like I showed you, is this it? I think this is it. I think I found it. Because I would have been so upset if I had found it after I had signed off. Here we go. How does coronavirus, COVID-19, affect people with asthma? Okay. And I know that I highlighted something. There we go. I quote, starting with the very first word here that is highlighted. Interestingly, research so far does not suggest any link between having asthma and getting a more severe COVID-19 illness, or between asthma and coronavirus deaths. Whether this is because the SARS-CoV-2 virus doesn't affect people with asthma in the same way as other respiratory viruses. Oh, see? They're already heading towards it. Or because there simply isn't enough data yet. Remains to be seen. You see that little opening that no other viruses or bacterial infections, as legion as they are, so as long as they've been in existence, have caused black people to die from respiratory failure, but this one somehow is different. That's what they're opening the door to. They go on to say, are people with asthma at higher risk of getting COVID-19? There is no, they say, so, doesn't that sound like your white nerve? So there's no hard evidence that black people, no, I'm thinking about black people. So there's no hard evidence that people with asthma get sicker with COVID-19. Yet, that's like Africa, right? Yet. But is there any evidence that people with asthma are more likely to catch the coronavirus? Again, not that we are aware of, not that the data shows, and they have lots of data, not just these 140 cases, but a study of 140 cases showed no link between coronavirus infections and asthma. They had a whole lot more cases than that in China. And they studied 1,099 patients, and they didn't find any link. That was originally what was uploaded to this particular site, and they yanked that down. I think I know why. It's related to the system of anti-blackness, but we're running long. So let me look at my time here so I can grade myself on time. Not bad. 2 hours and 15 minutes. And I think like I should just, if I could have, I would have let off with a a picture of how much TV watching black people do, but can't do that. So I will simply say that for today, losing track of the time because of this lockdown thing, it's Thursday. For Thursday, April 16th, 2020, this has been the Counter-Racist Evolving Engineer, the CREE platform. If you found this helpful, and I hope you did, please share it. You don't have to share it widely. Just share it within your little friend networks on Facebook, or send it as a private message, or even as an email. And then get to work actively opposing this false propaganda. You have the information. You are armed. Get on Twitter and start directing whenever you see this false information, even when you see it being repeated by black people who are using it to try to get more help. Counter it and let them know why this is more dangerous. What it could do to us, to harm us, has far greater chances than what it could do to help us. The idea that there are greater chances that this is going to cause non-black people to give us the resources we need because they now see what they've done to us, those chances are practically zero. The chances that they are going to seize upon this opportunity to control us more so that they can keep their eye on us, so they can know whether or not we're developing potential to defend ourselves and to do for ourselves, is much greater. Much greater. 2, they need more automaticity. They need to make it more automatic and easier to practice leeching off of us and using us and abusing us. That's more likely what's going to happen. So I would urge you to use your platforms on Twitter, on Facebook, or just person to person in text messaging. So you can send this as a text. You can queue it up if they don't have the patience for 2.5 hours, but please share it. And then please like it. Please like the video. And stay safe. For me, if we're talking about COVID-19, that means stay away from the hospital. A lot of times doctors are reaching out. You're not even calling them. They're calling you. They want to know how you're doing. Be careful about what you say. Take in all this data and be careful about what you say, because you could be talking about one thing and they could be writing COVID-19. Okay. Hopefully this does not get shut down. And I really am signing off this time. Signing out.